Most of the muscles of the leg can easily be seen using anatomical models. We'll start with the gluteus maximus. Gluteus means buttock, so this is the large buttocks muscle. When this muscle contracts, it will extend the thigh at the hip and will also laterally rotate the thigh. Just above it and slightly deep to it is the gluteus medius, the middle-sized buttocks muscle. When this muscle contracts, it will medially rotate the thigh and abduct the thigh. The group of muscles that make up the posterior part of the thigh are known as the hamstrings group. They are the biceps femoris, the semitendinosus, and the semimembranosus. The biceps femoris gets its name because it's near the femur and it has two heads. The heads or origins are on the ischium and the femur. It inserts on both the fibula and the tibia. The semitendinosus and semimembranosus also originate on the ischium, on the ischial tuberosity, but they insert only on the tibia. Because the hamstrings group crosses two joints, both the hip joint and the knee joint, it acts on both joints. So the hamstrings group will flex the knee and extend the thigh at the hip. The sartorius is a long, thin muscle that starts anterior and runs medial, runs down the leg this way. It gets its name from the word sartor, which means tailor. Now that may sound like a strange thing to name a muscle for, but tailors used to sit cross-legged, and the action of the sartorius are all the movements you need to sit cross-legged. When you sit cross-legged, you have to flex the hip and flex the knee. You have to laterally rotate the thigh as well as abduct the thigh. If you try doing that with both legs simultaneously, you will find yourself sitting cross-legged. The other superficial muscle is the gracilis. It's on the medial side of the thigh. Gracilis means slender, so this is a rather slender muscle when you see it head on. The gracilis is an adductor muscle. It adducts the thigh. It also helps flex the knee and medially rotate the thigh. Think of the gracilis as gripping or holding your legs tightly together. The adductor group are three muscles that obviously adduct the thigh. You have the pectineus, the adductor longus, and the adductor magnus. In addition to being strong adductors of the thigh, they also help flex at the hip and medially rotate the thigh. As we move to the anterior surface of the leg, we will see the quadriceps group, a group of four muscles that are very powerful muscles on the front of the thigh. The rectus femoris gets its name because it's over the femur and it has fibers that run straight up and down. Then the other muscles are very large muscles, and so they are the vastus muscles. The one on the lateral side is the vastus lateralis. The medial one is the vastus medialis, and if we remove the rectus femoris, you can see the middle one, the vastus intermedius. The rectus femoris originates on the ilium and inserts on the tibial tuberosity, so it crosses both the hip and the knee joint. It will act on both joints. It helps flex the thigh at the hip and extend the knee. The vastus muscles all originate on the femur and insert on the tibial tuberosity. They only cross the knee joint, so they only extend the knee. The tensor fascia lata is seen in this anterior view. This muscle is attached to a band of fascia that comes down all the way down the side of the leg. When the tensor fascia lata contracts, it will abduct and flex the thigh as well as medially rotate the thigh. More importantly, it's a stabilizer for the knee and the trunk. This muscle helps hold the hip joint and the knee joint in alignment and thus stabilizes those joints. You will notice that there are a number of other muscles we've already identified. Here's the sartorius, the rectus femoris, the vastus lateralis, and the vastus medialis. As we move to the lower leg, you will notice that the large bone of the leg, the tibia, is exposed here. The muscle directly in front of the tibia is the tibialis anterior. When this muscle contracts, it's going to dorsiflect the foot. As we move lateral to the tibialis anterior, we find the extensor digitorum longus, and notice how the tendons of this muscle go down all the way to the toes here. So when this muscle contracts, it will extend the toes as well as dorsiflex the foot. As we move to the lateral view, you can still see the tibialis anterior and the extensor digitorum longus. The lateral bone of the leg is the fibula, and the fibularis muscles or the peroneus muscles sort of surround the fibula. When this muscle contracts, it plantar flexes the foot and also pulls the foot outward so it everts the foot. This flat muscle here is the soleus. Think of the soleus like the sole of your foot, very, very flat. When the soleus contracts, it plantar flexes the foot. And then this large muscle on the calf is the gastrocnemius. The gastrocnemius gets its name because it's the big-bellied muscle. The swollen central part of a muscle is referred to as the belly of the muscle, and gastro means belly or stomach, so the gastrocnemius is the muscle with the big belly. The gastrocnemius originates on the condyles of the femur and inserts on the calcaneus. It crosses the knee joint and the ankle joint, and it will act on both joints. It flexes the knee and plantar flexes the foot. Moving to a medial view, there's the gastrocnemius and the soleus. And this muscle tucked right here is the flexor digitorum longus. Notice how it comes down, and you can see those tendons going to the bottoms of the toes. So this is obviously going to flex the toes. It also plantar flexes the foot, and it will pull the sole of the foot inward or invert the foot.